Chair recognizes Mr. Ruiz from California for 5 minutes.
Thank you, Chair Rogers. I echo my colleagues' concerns about TikTok's impacts on the health and well-being of the American public. As a doctor and the ranking member of the Select Subcommittee on the Coronavirus Pandemic, I am troubled that TikTok is rife with medically inaccurate information, including dangerous misinformation and the intentional disinformation about COVID-19 and vaccines. TikTok's community guidelines state that the company will remove content or accounts that involve, quote, misleading information that causes significant harm, unquote. However, since the early stages of the pandemic, TikTok has been used as a platform for people pushing misinformation, disinformation, including by those casting doubt on the safety and efficacy of life-saving vaccines. And despite TikTok's pledge to address harmful misinformation, these videos are being viewed millions of times. For example, the Institute for Strategic Dialogue found that a sample of 124 TikTok videos containing vaccine misinformation were viewed 20 million times. And Media Matters found that a sample of 18 videos with COVID-19 misinformation were viewed over 57 million times. Here's another shocking study. The Journal of American Medical Informatics Association found that when searching hashtag, quote, coronavirus on TikTok, almost 30% of the videos that came up contained misinformation. Videos in that sample containing a high level of misinformation were viewed a median of 9.4 million times. Mr. Xu, why are these dangerous videos falling through the cracks of your company's efforts to enforce its own community guidelines and remove harmful misinformation?
Before I answer that, in my response to an earlier question from Representative Dunn,
Mr. Xu, you're in my time. Answer my question.
I understand, but if I would like to clarify something.
I'm clarified. I have 5 minutes
Okay.
in my time. You're in my time now. Answer my question.
Yes, any dangerous misinformation we partner with third-party experts to be able to identify and help us with subject domain expertise. And with the expertise that we recognize, we rely on those to develop policies to recognize and remove content that could be.
Your efforts have failed, and they're dangerous, okay? It's public health risks that you're putting millions of people's lives at risk for not being able to do a better job. And I'm concerned that TikTok's features make it users uniquely vulnerable to the spread of this misinformation. For example, TikTok makes it extremely easy to reuse audio and videos to create content, which allows misinformation to quickly spread through the platform. And TikTok's algorithm to recommend videos means that a user viewing one video containing misinformation can easily result in their quote-unquote For You page becoming filled with videos containing similar misinformation. This is a dangerous feedback loop. So is TikTok taking any action to modify these features so that they no longer facilitate the spread of this misinformation or this misinformation feedback loop?
Congressman, again, like I said, any dangerous mis or disinformation, we work with third parties to recognize that, and it's proactively removed from our platform.
Okay,
so it doesn't need to get into those loops at all.
So I can go back and read you the data. And the Journal of American Medical Informatics, 30% of videos after searching for hashtag coronavirus had misinformation. Almost 1 out of 3, your third party and your company are missing almost 1 out of 3 misinformed videos. So you're telling me what you're doing. I'm telling you the data shows that you are grossly failing at that effort. The other question I have for you is that TikTok is also in Spanish, and Spanish-speaking populations have been specifically targeted to misinformation when it comes to many aspects, especially medical misinformation. And as chair of the Congressional Hispanic Caucus, we reached out to you last Congress on this issue. So what is your intent, or how does your team look like to address Spanish versus English? How many staff do you have focusing on Spanish versus how many staff do you have focusing on English misinformation?
Congressman, like I explained just now, the Spanish-speaking population is very important to our platform. We do have a lot of Spanish-speaking moderators, and we will continue to
So how
invest in them.
many Spanish-speaking staff versus English-speaking staff for misinformation do you have?
I can get back to you on the specifics, but dangerous misinformation is moderated regardless of language.
Not to the degree that it needs to be.
We can continue to work hard.
And when there's misinformation, people base their decisions that oftentimes put them at risk in exposures and their families at risk. And with the coronavirus, especially prior to the vaccines, the risk was their life. Thank you. Yield back.
Madam Chair, I would like to clarify something. In the follow-up question to Representative Dun's question just now, I misunderstood the follow-up about ByteDance spying on behalf of the Chinese government. My answer to that question should be a no, because it came very rapidly. I just want to clarify that.
Gentleman's time has expired.